Welcome to our PID class. I hope you're doing well. Today we are going to talk about complicated malaria, which is a subtopic under malaria. In our subsequent series, we are going to discuss about malaria in details. So, what is malaria? This is an acute febrile illness caused by infection with Plasmodium parasites and is transmitted from person to person by an infected female Anopheles mosquito. There are 5 Plasmodium species of malaria parasite which infect humans, namely people sperm. This is the most virulent, hence reportedly to cause severe malaria. And then we have P. ovale, P. vivax, P. malariae, and P. nullense. Let's look at features of uncomplicated malaria as we shall use them to contrast with features of complicated malaria. So the patient will present with fever that's above 37.5 degrees Celsius or history of intermittent fever, and then loss of appetite, mild vomiting, diarrhea, might have headache, they'll complain of general body weakness, muscle and joint pain. They will present with mild anemia. On examination, you can identify either through noticing palmar pallor, and then you also have mild dehydration. This the patient will be eager to drink. Then you also might have an enlarged spleen. It may be mildly tender on palpation. Let's contrast with features of complicated malaria. You should note that complicated malaria is regarded as the presence of sexual forms of people's sperm blood plus one or more of the following features below. Or you can say parastemia with one or more of the following features. You have cerebral malaria. The patient may present with deep coma with, of course, parastemia. Then you have severe anemia, that is HB less than 5 grams per deciliter with parastemia. You should note that we shall always say with parastemia. Okay. Then you also have respiratory distress, that is tachypnea, nasoflaring, intercostal recession in patients with parastemia. Then you also have hypoglycemia, that is random blood glucose of less than 40 milligrams per deciliter with parastemia. And then you also have circulatory collapse, that is shock. Patient will present with cold extremities, of course. Then you also have renal failure, that is urine output less than 12 mils per kilogram in 24 hours. Then you have spontaneous bleeding. This might be prolonged bleeding from the nose, prolonged bleeding from the gums, or from the sites that you've used to maybe establish an IV line. And then you also have repeated convulsion, that is 2 or more convulsions 24 hours with parastemia. Then you also have acidosis, that is deep breathing and plasma bicarbonates of less than 15 millimole per liter. Then you have hemoglobinuria. Hemoglobinuria is the presence of hemoglobin in blood, in urine, and then the urine will be dark colored. And then pulmonary edema, that is deep breathing, fast breathing, labored breathing. These are signs that can direct you towards pulmonary edema and can be noticed also on chest x-ray. Most supportive features include parastemia with unexpected jaundice, prostration, that is the child is unable to sit for the older ones, and then for infants they are unable to drink. We have severe dehydration, that is the presence of sunken eyes, inability to drink. Then you have hyperpyrexia, that is temperature of more than 39.5 degrees Celsius with parasthemia. Then you also have hyperparasthemia, which is a parasite count of less than 250,000 per microliter. And then also they may present with severe vomiting, and here they vomit anything they take in. So what are our differentials? For example, pulmonary edema may be due to respiratory infection. Also, you have urinary tract infection that can cause the urine that we saw. Then meningitis, of course, may cause deep coma, but we present with signs of meningeal irritation. Also, skin abscess. This may be the cause of spontaneous bleeding. Then you also have measles. These or other infections with rashes before the rash comes out, as these infections then present with fever. Yeah. So how do you remember the features of complicated malaria? In summary, this it's ABC. Remember, with A, B, C, D, poach. So this A is for acidosis. This is for spontaneous bleeding. This is circulatory collapse, repeated convulsions, respiratory distress, pulmonary edema, and then you can also have this can present hyperpyrexia and hyperparasthemia. Okay, wow, that is it. I hope you enjoyed. Subscribe to my channel, hit the like button. See you in the next lecture, my friends.